Hello, my name is Adam Sapris, and I will now begin with the presentation of the atomic bombing of Hiroshima in 1945 on behalf of Group 8. So let's start with a background of the event. On August 6, 1945 at 8:15 a.m., the first atomic weapon was dropped over a human population by the United States. At the end of World War II, Germany had agreed to surrender, however, Japan had not yet agreed to surrender. As the US were strategizing a way to end the war, the initial plan was to continue with a final bombing and to continue with a final massive scale invasion. However, this method was estimated to result in a large amount of casualties, so the US devised a new plan, which they thought could reduce the number of casualties and end the war sooner. This new plan required the use of the atomic bomb, which they named Little Boy. This 9,700-pound uranium-235 bomb was carried by an American bomber named the Enola Gray. The power of this bomb is equivalent in blast potential to 12,000 to 15,000 tons of TNT. The damage done to the citizens of Hiroshima was unimaginable. 50% of civilians within about a 1.2-kilometer radius of the hypo center died the day of the event, while many more died later due to direct wounds or severe radiation exposure. The total number of casualties within 5 years of the bombing was about 200,000 civilians. So dropping a destructive bomb like the one in Hiroshima would obviously cause various types of injuries, which include burns, mechanical injuries, blast injuries, and radiation injuries. For the scope of this presentation, we will primarily focus on radiation injuries. Gamma rays are the main source of radiation from the bomb, and gamma radiation is produced by the atomic nuclei during their transformation in fission process. Radiation came in two bursts. The first burst was an extremely intense one, which lasted only 3 milliseconds. It contained a large amount of ultraviolet and infrared radiation. This means that there was an immense amount of heat being generated. The rapid heat production results in the temperature of a person's skin to increase by 50 degrees Celsius. The second burst, in contrast, was less intense than the first. However, it had a longer duration. This second burst contained a large fraction of total light energy produced by the bomb, around 90%, and many more people were injured by flash burns at a greater distance than gamma radiation. So let's first look at the early effects when talking about bioeffects. Early effects can last from several months to years, and these effects include a variety of symptoms. The closer you are to the hypocenter, the higher the radiation dose received, and severe effects are observed if within 2,000 meters of the hypocenter. Mild effects appear after 18 days, and symptoms range from epilation and weight loss to pallor and petechiae, which are the red spots that manifest on skin due to bleeding of capillaries. Moderate and severe effects have a prodromal stage, where victims experience nausea, vomiting, and diarrhea within hours, followed by a latent stage where clinical symptoms are less pronounced. Symptoms are the same as seen in the mild effects, but are more severe in the moderate group. Patients recover from moderate effects unless they are complicated by previous poor health or superimposed injuries or infection. For severe effects, on the other hand, the mortality rate is 100%, and the latent stage is much shorter, a period of 2 to 4 days, in contrast to the latent stage of 2 to 10 days in the moderate group. We will now look at some of the late bioeffects. And cataracts was one of the earliest onset impairments seen. Leukemia was a delayed effect that manifested earliest with respect to other delayed effects. And in the case of cancers, survivors had an increased risk for acute and chronic myelocytic leukemias and for acute lymphocytic leukemia. The probability of cancer caused by radiation depends on the dose received, age at exposure, and sex, but females and younger victims have a higher risk. Chromosome aberrations include an increased frequency of reciprocal translocations and inversions associated with a higher radiation dose. Blood cell mutations were also seen and include mutations of glycophorin A in erythrocyte populations, as well as mutations to hypoxanthine guanine phosphoribosynthyltransferase in T cells, which are part of the immune system. We will now begin the late effects discussion, and much of this data was determined over lifespan studies, which revealed that stomach, lung, and colon cancers were among the highest incidences for Hiroshima survivors. Survivors can consider radiation therapy treatment, consultation with specialists such as radiation oncologists or gastroenterologists, and continual annual health checkups are deemed to be crucial. Survivors also experience post-traumatic stress disorder, and while this may not be a direct result of radiation exposure, we as a group think it is worthy of discussion, as this is a severe disorder that is a result of the Hiroshima bombings. It manifests as anxiety and fear, as well as chronic headaches or dizziness as a result of the bombing. It is important for them to seek the therapy they need and support from one another to maintain balance in life. We will now look at the prenatal bioeffects. And the highest period of risk is between the 8 to 15 weeks of gestation period. So within 8 weeks, cells retain their mitotic capacity. So if they are damaged, they can be replaced. However, past the 15-week point to about 26 weeks, the development of the cerebrum is almost complete, and differentiated cells generally have a greater resistance to radiation. So that is why in between this 8 to 15-week period, we see the highest level of prenatal radiosensitivity. So radiation or prenatal radiation results in severe delayed growth and development, as well as decreased head circumference, height, and weight. Children cannot complete primary level education while demonstrating lower IQ scores for those within the severe mental retardation group. It is important to note that mental retardation effects seem more stochastic in nature, as there is no observable threshold dose for mental retardation. So in this case, the likelihood of this manifestation is more prominent with increased radiation dose exposure. However, there is no exact threshold dose as mentioned. So we'll now begin to look at some of the treatment responses to acute radiation syndrome. So epilation was the symptom most commonly reported, and severe epilation increases with exposure of 1 gray up to 5 grays, with no treatment options available, unfortunately. Nausea, vomiting, and burns were some of the other more clinically prominent symptoms, and these were dealt with in a more pharmacological manner. So pain was managed with analgesics and nausea with antiemetics, whereas topical medications and cold compress were used to treat many burns. If we look at the hematopoietic syndrome, where the bone marrow's lethal dose 50 is determined to be 2.7 to 3.1 gray for victims within 1,000 to 1,200 meters of the Hiroshima hypocenter, we do see difference in treatment depending on mild or severe hematopoietic syndrome. So, for mild hematopoietic syndrome, platelet transfusion can be undergone, isolation precautions are taken, and antibiotics for any specific infections are associated with the blast site. These are also used. A high protein diet is also promoted to balance low white blood cell count. However, in the case of severe treatment, it can be seen as clinically different from the mild treatments. So in the case of severe treatments, or in severe hematopoietic syndrome, replacement of electrolytes and intense hydration is promoted. Transfusion of red blood cells and white blood cells can also be done as a procedure. Stimulation of hematopoiesis with growth factors can also be done, and no bone marrow transplant should be done to avoid any immunological reaction. So, some of the solutions to biological effects. Looking further into this discussion, the bomb nearly demolished the Japanese Red Cross hospital in Hiroshima. However, its walls were still intact, so it was able to house thousands of people while getting treatment. So treatment was limited though, as most laboratory equipment was damaged or destroyed and many of the drugs were contaminated in the explosion. The people of Japan performed standard care to treat radiation-induced burns and other physical injuries. Rest, high vitamin, and high caloric diets were also implemented to help counteract some of the biological effects of radiation. Other methods of treatment included injections of calcium to aid in liver health, and blood transfusions were also performed. Lastly, we'll look at some more solutions. These are not biological in nature. These are more so legislature that has been put in place to help in long-term cases. So in 1953, Hiroshima established the Hiroshima Atomic Bomb Survivors Treatment Council to provide free medical treatment and health checkups for survivors. In 1956, the Hiroshima Atomic Bomb Survivors Hospital was built to give survivors examinations, treatment, and health management services. And lastly, in 1957, a bomb survivors medical care law was passed in which survivors could receive health examinations and medical care by using national funds. And with that being said, here are the following references used for the presentation, and we'd like to thank you for your time and attention during the presentation.